there, it's Luisa Lyons here, midwife and lactation consultant, and this short video is just a bit of information for you about how to increase your breast milk supply if that's something that's important to you. So the first thing to say is that most women make enough milk for twins in the first few weeks, up to about 6 weeks after birth. So not very many women will have a truly low milk supply, but a huge number of women have a perceived low milk supply. So do reach out for help from a trained IBCLC lactation consultant if you are concerned that you might have low milk supply. But in general, these tips will help you to maintain and optimise a good milk supply. So the first thing to say is that really important is to understand the physiology of milk production, and that good breast milk production is really governed by hormones and also by removal of milk from the breast. So initially the prolactin hormone is really important for stimulating milk production, and the best way to stimulate milk production is to go for early, frequent and effective feeds. So frequent means at least 8 to 12 feeds in 24 hours, and effective means that you're draining the breast effectively. And nice and early means as soon as possible after birth. So hopefully that will be possible. If your baby is unwell and is on the neonatal unit and can't breastfeed directly, then mimicking this with a pump and hand expressing is really important for early, frequent stimulation of the breasts and really effective drainage of the breasts, whatever method you're using, whether it's your baby, your hands or your pump. So the other thing to note is that a more drained and emptier breast will have a faster rate of milk production, and a full breast will have a much slower rate of milk production, because the breast responds to the need for an increased milk supply by the demand placed on it. So the more you take out, the more it will fill up, and the less you take out of the breast, the less it will fill up. So that's why it's really important to drain the breasts frequently and effectively by whatever method, preferably baby, but if baby's unable to drain your breast frequently and effectively, then as I say, by hand expressing and then pump expressing. So as long as the milk is taken out effectively and removed, then milk production should continue. One of the things that can affect this is retention of placental tissue. So if there's a little bit of placenta or the membranes that surround the baby in the womb left inside the womb after birth, that can really negatively affect milk production. So if you do have symptoms of low milk supply that manifest perhaps as weight gain problems or excessive weight loss for your baby, then it's really important to see your midwife to check that there are no signs of retained tissue of placenta or membranes. And the symptoms of this would be abdominal pain, abnormal bleeding, smelly blood loss, and also feeling unwell, perhaps even feverish. So the main things that affect a good milk supply are making sure that you have really good positioning of the baby at the breast and attachment, so an effective deep attachment of the baby at the breast. Things that can affect this are inability to position the baby effectively, but also things that can affect attachment are oral anatomy issues such as a high palate, a restricted frenulum, otherwise known as a tongue tie, problems with the baby's tone or neurological problems with your baby, or other anatomical issues like cleft lip and palate. So please do seek out skilled support from your IBCLC if any of these issues are affecting you. And if you have got worries about your milk supply, do reach out so that we can help you determine what the cause of that is, whether it's to do with the baby's oral anatomy or if it's to do with the hormones of lactation that include things like thyroid hormones, insulin and other hormones, or whether it's due to glandular issues in the breast itself. If you have sore nipples, that's a real red flag that something's not right. There shouldn't be pain after the first few seconds of latching your baby on. There shouldn't be pain in the nipples or the breast at all. So if you have any kind of sore nipples, blocked ducts, whitening of the nipples called vasospasm after a feed or pumping session, then please get in touch. The other thing, apart from good positioning attachment, is frequency of feeds. So I mentioned at the start at least 8 feeds in 24 hours, and the normal kind of range of frequency of feeding is somewhere between 8 and 12 feeds that last somewhere between 5 and 35 minutes. If your baby is persistently feeding more than 14 times in 24 hours, That would suggest that there's something not quite right, perhaps with the attachment or with the baby's oral anatomy or other factors, or with your breast milk supply. So again, if that applies to you, please do seek out some support. Things that can also help is skin to skin contact, which stimulates the production of prolactin hormone and oxytocin hormone, which helps milk to be released with the milk ejection reflex. So lots of skin to skin in the early days and weeks, for as long as it feels good for you. Your baby will benefit massively, not just physically, but also emotionally and psychologically from skin to skin, as will you. Using breast compressions can really help. So compressing the breast during feeding or pumping or both, to create positive pressure down the breast to enable more milk to be drained out of the breast is really good. And for this, please get in touch. Have a look at our videos on No Milk Like Mamas and on the Jack Newman website for more information on effective breast compression technique. Offering both breasts can really help as well. So the baby may not have both breasts, but always offer the second side after the first breast. And if you're struggling with slow weight gain or excessive newborn weight loss or jaundice or a sleepy baby, then switch nursing can really help. And that's where you offer the baby the breast, do really effective deep breast compressions, and then when that stops working and your baby stops swallowing effectively and actively, you switch them to the other side. And then you repeat, do breast compressions again. And as soon as that stops working and they stop suckling actively, switch them back. So you might get 5, 6 or 7 sides in a feed of just a few minutes each. And this method is just used for issues with weight gain, jaundice, sleepy or unwell babies, or babies with cardiac issues or chromosomal issues. The other thing to say is that you can increase your milk supply with pumping or hand expressing. And this can really help because, again, the more milk you remove, the more milk will be replaced. Avoiding dummies is really important. So dummies or pacifiers in the first few weeks, particularly when your milk supply is establishing, can mask those feeding cues. And babies can suck on a dummy instead of wanting to feed, and they can sleep through their cues or be put off from feeding. So it's best to avoid these in the first few days and weeks. A lot of people ask me about maternal diet and whether a mother's diet will affect her breast milk supply and also the quality of her milk. And we always thought that it didn't affect breast milk until the mother reached a BMI that was very low and she was very underweight, for example, lower than a BMI of 18. But we're now wondering if there might be subtle changes to the quality of the breast milk if a mother is very underweight. So the prevailing thought at the moment is that although there's usually a very, very minimal effect of maternal diet, if you are significantly underweight or you have a very low fat diet, that this could affect the fats in your breast milk. And in a recent research study done by Mohammed, they found that babies whose mothers had a low fat but high carb maternal diet had less milk than those that had a low carb but high fat diet. So that's something to bear in mind. It suggests that higher fat, lower carb diets may be beneficial for breastfeeding. But in general terms, it's important just to eat a healthy, varied, balanced diet, if nothing else, to make you feel better and be able to cope with the demands of a new baby in terms of tiredness and sleep deprivation, and obviously staying really well hydrated. But generally, drinking more water should not affect your breast milk supply unless you're really dehydrated. So if you're really underweight or you struggle with weight gain at all, or you're vitamin deficient, that could affect your milk supply. So please get in touch with an IBCLC. And a really good resource for this is the Making More Milk website and book. So have a little look at Making More Milk and do reach out if you'd like more support. Hope that helps.